Welcome back. 6:50 now, and today could be the start of the end of the virus blamed for killing thousands of people every day.
That's right. Life-saving doses of COVID vaccines are being delivered today all over the country. When will we see that here in Texas? Well, joining us this morning is Dr. Mark Escott, interim Austin Travis County Health Authority. Good morning to you, and thank you for joining us.
Good morning. Happy to be here.
All right, let's start off with this. Have you received any kind of doses in Austin, and if not, when do you expect to?
We expect those to start arriving any day now as part of that initial allotment coming from the Department of State Health Services focused on getting our hospital workers vaccinated.
And when it comes to the vaccines, I know that you're waiting on direction from the state and the federal level. Are you getting that much needed guidance? Will you know what to do? Are they communicating with you locally?
They are communicating with us. I had a conference call yesterday with the state to share some of the more detailed information regarding vaccine administration and the recommendations that we'll be rolling out. So we're very excited to start this process. It's a long road ahead, but it's finally here.
And Dr. Escott, how likely is it that in the days ahead you are planning on enacting a curfew as our numbers keep going up? And is there actual evidence that curfews can help stop the spread?
Well, Tom, what we're experiencing now is ongoing surge in cases and hospitalizations. Looking at the projections over the next several weeks, we're concerned that we may be heading into territory which is unsustainable, and we certainly must avoid at all costs a surge that like that was experienced in El Paso. So one of the options to further mitigate the risk and slow the spread would include a curfew.
When you say unsustainable, what does that actually look like in tangible terms?
We're talking about a surge that was several times that we experienced in June and July. We're talking about a surge that could result in another 1,500 deaths in Travis County if it's of the magnitude that was experienced in El Paso. It's a devastating surge. It's possible. We've seen it happen in El Paso. We've seen it happening in Lubbock and around the state of Texas. We must avoid it here.
So will you recommend a curfew then?
Again, we're reviewing the options of a curfew. Exactly what we can focus on with the curfew. I'll tell you right now, our concern is those bars that are now operating as restaurants. We have seen violations of COVID-19 restrictions in those establishments, and they represent a significant risk to us that we need to address.
Dr. Escott, it's one thing to maybe enact a curfew or to get the vaccines here in Austin, but it's another thing to actually get people to trust this vaccine and to take it. What are you going to be doing here as a city to make sure you ensure confidence in this vaccine?
Well, first off, we've had a coalition developed for many weeks now of more than 100 individuals. Those are healthcare providers as well as community advocates to hear the concern and to develop messaging to better explain the safety and the efficacy of the vaccine. My hope is that as the information has come to light, the FDA discussions regarding the Pfizer vaccine and soon the Moderna vaccine, that trust will come as well. And I'm hopeful that folks will take advantage of the opportunity to get vaccinated so that we can head back to normal.
You know, the mayor had some headlines when he was called out for traveling during the pandemic. He said he did that after consulting with you. We wanted to ask the same question. Have you traveled during the pandemic? Well, we acknowledge that circumstances now are much different than they were when he traveled in November.
I traveled to Kyle recently with my family to stay in an Airbnb. But that's about it. Nothing exciting.
Okay.
Dr. Escott, before we let you go as well, I know that your spouse is in the education system, and when it comes to getting vaccines to those frontline workers, healthcare workers, what is your opinion on having teachers get this vaccine among the first early group as well?
Well, our strategy is going to focus first on securing our hospital infrastructure, then those who are really at the highest risk of death, Those over 60 years old represent 81% of our deaths. So we really need to hit those next. But essential workers are important for us to return to normal, and teachers are certainly in the group that needs to be prioritized.
Tell me your confidence level when it comes to will we have enough vaccine doses here in Travis County?
There's no question that we'll have enough. The issue is that it's going to take a while for those doses to come in. We need about 200,000 to hit individuals over the age of 60 to start to move away from that risk of our hospitals being overwhelmed. But it will take a while to get 500, 600, 700,000 doses that we need to really feel comfortable.
I want to ask you one more question. The warning ahead of Thanksgiving was do not travel. How well did Austin do as a community staying home? And what's the advice ahead of Christmas?
Well, unfortunately, the surge that we're seeing now is attributable to Thanksgiving. And we cannot tolerate a similar effect post-Christmas and New Year's. Illness and disease and death right now is like deaths that happen in the war when the peace is already being negotiated. We have a solution. We're negotiating the surrender of this vaccine or this virus through vaccine. Now's the time to be vigilant and not take risks.
Dr. Mark Escott, thank you so much for joining us this morning. We learned a lot and we appreciate your time. Thank you for all you do.
My pleasure.
Thank you. Let's go over to David.